Hi, Dr. McSwain. How are you? Today I want to talk about all the tension that I see that people store in their lips and how they start tightening their lips and then they start pulling all the tissue around their lips, which ultimately creates a lot of tension in their mouth, jaw, neck, base of their skull, where there's important blood supply. And then also, aesthetically, you just see a lot of wrinkles, tension wrinkles, and pulling around the lips. And honestly, even with PRP and PPP, if your lip tension is there, there's really not much you can do for tissue rejuvenation because you keep using those lines for pulling. And so I want to talk to you first about what is the normal contour of the lip so that you can understand actually when you look in the mirror, are you using the lip contour in a way that isn't tightening or pursing your lips. So the lip actually has peaks at the top, and then you can see a little bit of lip around the edge, and then you can see almost two layers. You can see maybe like a drier layer in the front, or like a more skin-like layer, and then deeper to that is a much more mucosal looking layer or component. So, honestly, for people who are they're going to be very tense in their neck and a lot of pull, and people also kind of grind in their face when they're doing things. This happens a lot in yoga, in movement, in tension, or people who are thinking hard. So all those things might resonate with you. And just what I want to show you, and I actually use KPS as C+ treatment for this because it helps release some of that fibrin binding in the actual lip tissue itself, but it's really how big is your lip. And so that's the cool thing about using KPS. You can put it on your finger or a little stick, and when you do, you'll actually see, and you can be really, this will look a little silly, but it's really fun. You can actually see like that's your lip. And when you do, you might take a nice deep breath like I just did, and you just kind of roll that out, and you can add more KPS C+ treatment, and then come down, grab what you feel is your lip normally, and open it. And then kind of pull it down a little gently and wide. And as you do that, you can actually appreciate how much tension we hold there. And another component of this idea is to create the space in the lips, have a little bit of opening, and just let your jaw sit there. Because if you immediately go back to a hold, then you're going to go back to where you were before. So if you actually come in and you just keep your jaw open by keeping your lips full and not coming back to a pressure point in your face, then you might feel a lot of achiness here because that jaw muscle is releasing tension. So that is definitely a check-in when you're going throughout the day, acknowledging how much tension you're holding, things like that. So thank you very much, and have a beautiful day.